Welcome back to my channel and welcome back for another edition of Health Class. Today, isa na namang request ang ating pagbibigyan. This requested topic is specifically for women as we are celebrating women's health and women's health is important. We have talked in the past about endometrial cancer. Today, pag-uusapan natin ang endometriosis. Alam niyo ba na according to the World Health Organization, as per the year 2023, endometriosis affects roughly 10% of reproductive age women and girls worldwide. That's around 190 million women around the world. Kaya dapat lang pag-usapan natin ang endometriosis. Dahil importante ang kalusugan ng mga kababaihan. Pag-usapan pa natin to, kaya just keep on watching. My name is Ryan, and I'm specializing in diabetes, men's sexual health, alcohol and drugs, primary care, and alternative medicine. Ang endometriosis ay isang chronic disease. Pag sinabing chronic disease, ito ay ang mga kondisyon na tumatagal or pangmatagalan. Ang endometriosis ay nagbibigay ng life-impacting pain. Severe pain during menstrual periods, sexual intercourse, bowel movements, and or urination. Ang common symptoms ng endometriosis are abdominal pain, pelvic pain, bloating, nausea, fatigue or tiredness, and sometimes depression, anxiety, and infertility. Sa kasalukuyan, walang gamot ang endometriosis. At according sa World Health Organization, in the year 2023, ang endometriosis affects roughly 10% of reproductive-aged women and girls worldwide. Roughly, mga 190 million women yan around the world. Ang endometriosis ay ang pagkakaroon ng tissue na kapareho ng lining ng uterus. At ang tissue na ito ay tumutubo sa labas ng uterus. At dahil dito, nagkukos ito ng mga pain symptoms. Normally, wala dapat tumutubo na tissue outside the uterus. Pwedeng magsimula ang endometriosis sa first menstruation up to the last menstruation or menopause ng isang babae. For example, if ang babae ay nagsimulang mag-menstruation at the age of 16 at nagka-endometriosis, pwedeng mag-last ang endometriosis hanggang sa ang babaeng ito ay magka-menopause. Ganun katagal kasi nga ang endometriosis ay walang lunas, walang cure. Pero pwedeng ma-manage ang mga pain-related symptoms sa pamamagitan ng mga painkillers or analgesia, kagaya na lamang ng mga non-steroidal anti-inflammatory drugs, kagaya ng ibuprofen o Nurofen at naproxen. Nakakatulong din ang mga hormonal medicines, kagaya ng mga contraceptive pills, mga intrauterine devices, vaginal rings, implants, injections, at patches. This is to help control menstruation that can cause pain. At syempre, meron din tayong mga operasyon or surgery para i-remove ang mga lesion at scar tissues na nagiging sanhi ng endometriosis at pananakit or pain. Ang tissue na tumubo outside sa uterus ay pwedeng maging sanhi ng inflammation at scar tissue in the pelvic region and very rarely elsewhere in the body. Wala pang lunas or cure ang endometriosis currently at wala ding mga ways para ma-prevent ang pagkakaroon nito. At kung magkakaroon man ng lesion sa other parts of the body, ito ay kadalasan sa pelvic peritoneum area. Pwede ring magka-lesion ang ovaries at sa rectovaginal septum, bladder, and bowel. At para mas maintindihan kung paano nabubuo ang lesion or tissue outside the uterus at ang pangkalahatan ng endometriosis, panoorin natin ang video na ito.
Endometriosis is a condition in which the endometrium, the tissue that lines the inside of the uterus, grows abnormally elsewhere. Common locations include the ovaries, fallopian tubes, outer surface of the uterus, and other pelvic organs and connective tissues. The endometrium may also grow into the muscular wall of the uterus, in which case the condition is known as adenomyosis. The endometrium is a special tissue. It undergoes periodic changes with each menstrual cycle. Each month, under the influence of estrogen, the lining of the uterus grows and thickens in preparation for the possibility of pregnancy. If fertilization does not take place, the tissue breaks down and is shed in menstrual bleeding, and the cycle starts over. In endometriosis, the displaced endometrial tissue behaves the same way, but the blood has nowhere to escape. It irritates the surrounding tissues, causing inflammation, scarring, and possibly adhesions. Depending on the location, endometriosis may cause a range of symptoms and problems, but the most common complaint is pelvic pain, which can be of various kinds. Symptoms can be very different from person to person. Endometriosis is very common. It is estimated that about 10% of women of reproductive age have some degree of endometriosis. Higher risks are observed in women who have never had children, started periods at an early age, heavy periods that last longer than usual, shorter cycles, relatives with endometriosis, or abnormalities in the reproductive organs. Endometriosis usually develops several years after the start of menstruation. The condition may temporarily improve with pregnancy and may go away with menopause. Diagnosis is usually based on symptoms, but because most symptoms are not specific, other conditions that may produce similar symptoms must be first ruled out. Pelvic exams and imaging tests also help, but only a biopsy obtained by means of surgery can give a definitive diagnosis. While endometriosis is not a cancer and usually not life-threatening, it may cause infertility and/or unbearable symptoms in some women. Treatment options include pain medication such as ibuprofen, hormone therapy such as birth control pills to help control endometrial growth and prevent new implants. This, however, only works for as long as the medication is taken. Symptoms usually return after treatment is stopped. Surgery to remove endometrial implants may provide a definitive cure for severe endometriosis. It may also improve fertility, provided that the reproductive organs remain intact.
There you go, everyone. Laging tatandaan na ang endometriosis is a life-impacting disease and it can be a lifelong disease. It can cause psychological and emotional issues. It reduces the quality of life due to severe pain, fatigue, depression, and anxiety. Ang pagkakaroon ng infertility dahil sa endometriosis can cause depression and disappointment sa mga couples na nais na magkaanak. And due to severe pain, some people are unable to go to work or school. Nagkakaroon din ng relationship issues ang ibang couples dahil ang endometriosis can also cause painful sex affecting both partners. Laging tatandaan na kumonsulta agad sa inyong doktor, lalo na kung nakakaranas kayo ng mga symptoms ng endometriosis. Thank you for watching. I shall see you again on my next health class. Stay safe and be healthy.